Hi everyone, my name is Chris Mann, my pronouns are he, him, his, and I'm the Program Manager for UCLA's Gender Health Program. Today's webinar is titled Insurance Navigation 101. Before we dive in, I just want to remind everybody that you're free to ask questions via Twitter using the hashtag UCLAMDChat. So now for a brief overview. Before I get into it, I just want to say that navigating insurance can be very challenging and very frustrating at times. So my hope in doing this webinar is to help clarify some information, and hopefully you'll learn something new about how to navigate insurance. One of the other things that I want to mention is that this insurance will look broadly at the various types of insurance, but also be bound to the state of California. To get into all of the other states would be a series of other webinars, and today we're just going to focus in California. But at the end, of course, I will give you resources that you can look to look at other states and the insurances that are based in there. Of course, we're going to go over the various types of insurance that exist out in the market. And then also look at how you can look into accessing gender-affirming care through your insurance. So I wanted to start off with this slide from the HRC, or the Human Rights Campaign, because this underscores how gender-affirming care really does vary state by state. The deep blue represents states that, that ban specific exclusions in insurance for trans healthcare, as well as offer really comprehensive and inclusive health benefits for trans folks if they're a state employee. The medium blue corresponds to states who offer trans exclusions in their insurances, and then the light blue represents states that provide inclusive benefits for state employees. So again, it really does vary on where you live in the United States, so it's always important to keep that in mind. So now we're going to get into the various insurance types. So health maintenance organizations, or HMOs, are really common. Preferred provider organization, PPOs, Medicaid, which is state-based health insurance. In California, ours is referred to as Medi-Cal. We also have Covered California, which is kind of the on-exchange, meaning that folks can purchase this on their own accord. And then Medicare, which is a federally state-funded health insurance program. And we'll get into a little bit of what each of those are as we go on through the presentation. Of course, in navigating insurance, and what makes them a little bit challenging is the terminology. So I think it's really important to start there first. The premium is the monthly payment that you make to maintain health insurance. Generally, if this is offered through your employer, it'll be taken out of your check. If you are purchasing it on the exchange, you will pay out of pocket each month. And then if it's a government-based insurance, whether it's Medicaid or Medicare, that'll kind of vary, but generally that's offered at a really, really, really low cost. So again, out-of-pocket expenses is what you pay in accessing healthcare. So that's kind of the umbrella term that includes your deductible, your co-payment, and your co-insurance. The deductible is the amount you pay before your insurance kicks in. So that kind of varies depending on the plan that you have. But generally, it's a couple of $1,000s. Then once you reach that cap, your insurance will kick in and start paying for everything from that point on. But there are some variations again. That's what makes navigating insurance a little bit tricky, is that each kind of policy and plan is a little different. The co-payment, or also known as the copay, is the amount that you pay every time that you access care. So if you go into a primary care appointment, it'll be anywhere from like $15, $20, $25. It's definitely lower than what you would be expected to pay if you were to pay for the entirety of the appointment. Co-insurance is the percentage of the bill that you are responsible for. So again, just because something is covered by insurance does not mean that it is free. So if you're looking for gender-affirming surgeries, you will be responsible for some pay. In-network is also going to be very important. So in-network are doctors, surgeons, health organizations that take and accept your health insurance. And again, it's going to be really important for you to know that. So if you're looking for a specific program, a specific doctor, you're going to want to make sure that when you're approaching insurance that you're asking if this health system, if this surgeon is in-network. Out of network, of course, is the opposite. So if they're not in network, they will be out of network. So folks or health systems who do not accept your insurance. So now getting to HMOs. So HMOs are generally offered through employers and on the exchange. Premiums are generally lower, so the amount that you pay each month, and the deductible is usually lower. You will be required to pick a primary care provider, and if you don't, someone will be assigned to you, someone that is in network. HMOs kind of function as a mother may I approach in order to access specialty care, to go to a urologist, OB-GYN. You'll have to get what's called a referral. So you have to go in for an appointment with your PCP, explain to them what service or where you would like to go in regards to specialty care, and then your provider will then send a referral out, and then your insurance will authorize it. Once you get that authorization, you're then able to access the care that you need in a specialty care setting. If you're accessing care outside of network, it can get pretty expensive, so it's always going to be really important to stay in network. And then again, if you're purchasing on the exchange or through Covered California, there's going to be certain tiers, and those will vary about how much your premium is, your out-of-pocket expenses. So it's really going to be important for you to check those out. PPOs, again, like HMOs, are generally offered through your employer or on the exchange as well. Premiums and out-of-pocket expenses are generally higher. Deductibles do vary, but there is greater flexibility in getting the care that you are looking for. With PPOs, you do not need to get a referral to access specialty care. So whenever you're ready for that consult, whether it be for top surgery, bottom surgery, or just even routine care through a specialist, you can go ahead and call and make an appointment without getting that referral. So some folks do choose to go the PPO option if it's within their means. Also, if you choose to go out of network, there's generally better coverage, but it's always recommended that you stay in network. And again, if there's a specific doctor, health system that you're interested in going in, it's going to be really important that you ask if the PPO insurance that you're looking into is accepted at that office. And again, the same with HMOs. If you're going through the exchange, there is a tier system, which will also impact, again, premiums, out-of-pocket expenses. So again, it's really important for you to do your research. So I've been mentioning Covered California. So Covered California is the exchange or the market for health insurance here in California. It provides health insurance coverage for folks who maybe don't get it offered through their employer and do not cover for Medi-Cal. Again, there's a variety of HMO and PPO plans from a variety of payers. And again, plans do vary based on bronze, silver, gold, platinum, etc. The open enrollment period to get enrolled in Covered California is generally November through December, but for more information, you can go to coveredcalifornia.com. And then also for other states, you can go to healthcare.gov as well. So again, it'll give you all the information that you're looking for. And yeah, it's a really good place to get that healthcare if your employer doesn't provide it and you don't necessarily qualify for Medicaid. Medicaid or Medi-Cal here in California is state government health insurance. You must be a California resident in order to access Medi-Cal. It provides health insurance for children and adults with limited monthly income and resources, so you have to meet a certain threshold. For more information, you can go to medical.ca.gov. Again, I believe they have a calculator, or they have some kind of system that'll let you know if you qualify for it. You can also go to local department healthcare services offices, so that resource is here. And it is important to mention that Medi-Cal does cover gender-affirming care and surgeries. So again, if you're looking for hormone replacement therapy, top surgery, bottom surgery, any kind of surgery, it's really going to be, you can get that care through Medi-Cal. Another defining characteristic of Medi-Cal that's important to note is that they will assign you to somebody who will be your primary care physician, and like an HMO, you do have to go to them before you seek specialty care or surgery consults. Medicare. Medicare is a federally funded health insurance program for folks 65 and older or who have chronic health conditions or certain disabilities. It's accepted by most care providers in most health systems. Part A, Part B, Part D. So this will be really important because I think you can opt in and out of which ones that you want, but generally those are the three that most folks will look at if they're pursuing Medicare coverage. Medicare does cover medically necessary hormone treatment and some gender affirmation surgeries. So again, it's really going to be important for you to be really connected to a team that knows your care and knows your insurance and helping you navigate what your health benefits are. Again, there is a Medicare website that is out there, so if you do a quick internet search, you'll be able to find exactly what it is that you need. In accessing gender affirming surgery, it's going to be very important for you to know the World Professional Association for Transgender Health, or WPATH. They publish a standards of care document that pretty much outlines any kind of medical, surgical, or mental health care that you might be seeking as a trans or gender diverse identified person. What's important to note, though, is that these standards of care are really seen as guidelines, not law. But what makes this really important for this talk in particular is that a lot of insurances base their insurance coverage and what it is that you need to access gender affirming care based off of these standards. Version 7 is currently up, and I believe version 8 is slated to come out sometime this year, but we'll see. So if you've never heard of this document, I really would encourage you to look at it as a patient and a provider, because as a provider, it also gives insights on how to deliver gender affirming care. So it's a really great, robust document. Also, it outlines what needs to be put in the letters that are required for gender affirming surgeries, and we'll get into a little bit of that later. So now we're going to talk about gender affirming care in general through insurance. So primary care, specialty care, hormone therapy, and gender affirming surgeries are covered in California. Again, we spoke a little bit earlier how that varies state by state. Covered, again, does not equal free. Patients are responsible for some costs. I think a myth out there is that, oh, it's covered, I won't have to pay anything. That's not necessarily true. It really depends on the kind of insurance you have and the plan. So it's really, again, it's important to know what your out-of-pocket expenses are going to be, what's your deductible. All of that is going to be really important for you as an individual in accessing gender affirming care. Generally, most insurances do not cover facial femme surgery or facial reconstructive surgery and voice surgery or therapy. They're deemed as cosmetic. That's not our opinion. Our opinion here at the Gender Health Program, and I think for most trans health programs, is that these are all medically necessary. They are life-saving, but that's currently where we're at right now. So there is an appeals process and that you can pursue as somebody who has health insurance. And again, it's really important for you to kind of have a network of folks who can really go to bat for you and provide that advocacy to your insurance. Generally, that's primary care physicians, specialty care physicians, mental health professionals. So getting into a little bit of what the letters look like. So for top surgery, right, or chest reconstructive surgery, whether that's double mastectomies or breast augmentation, generally you need one letter from either a primary care doctor or mental health professional. Again, each plan varies, so to really look at your trans health policy and figure out what it is that they're looking for. And also in the letter, which is outlined in the standards of care document through WPATH, it outlines what certain points need to be in the letter in order for insurance to cover it. 2 letters or statements of medical necessity are needed for bottom surgery or any kind of below-the-belt surgery. So we're talking about orchiectomies, hysterectomies, vaginoplasty, phalloplasty, anything that is below the belt will require 2 letters. And again, there is some variance on whether a doctor can write that letter or it needs to be a mental health professional. So it's going to be really important for you to kind of figure that out. And then also, too, it's important to note that some programs, trans health programs or doctors do require a letter for starting hormone replacement therapy or HRT. Others operate from an informed consent model. So that'll also be something that you'll need to do some research on as well. So pediatric patients. So health insurance in California does cover gender affirming care for pediatric patients, so folks that are less than 18 years old. Each patient and caregiver system is unique, and ideally pediatric care for trans or gender diverse youth really should involve the care system, whatever it is that it looks like. And it's also important to note that in the state of California, any kind of medical or surgical intervention needs parental or caregiver approval. So that's law. So it's going to be really important for you, if you're a youth looking for this care, to really understand that. So again, I get a lot of questions about, is my insurance contracted with UCLA Health? Because folks, regardless if you're trans or gender diverse identified, want to come to UCLA Health. So UCLA Health is contracted with a variety of HMO, PPO, Medi-Cal plans, and Medicare. You can verify with your insurance directly if UCLA Health or the specific doctor is in network, or you can go to these resources here. You can call 1-800-UCLA-MD1 or visit us online as well to figure out if your insurance is accepted here at UCLA Health. And again, you can also call your insurance directly and mention which doctor or healthcare system you're looking to visit. So now some important insurance considerations to keep in mind as you're kind of navigating insurance landscape, figuring out which plan is best for you. Research is going to be very important. We really want you to make sure that it's within your means to pay for the insurance that you can pay for. So that's going to be like kind of the basis. We really want to make sure that you're accessing health insurance that you can afford. And then also, when you're accessing health insurance, you can ask if they have a specific transgender health policy. And again, this is often informed by WPATH. And in order to figure that out, you can ask any kind of insurance rep that. Or you can look at and request your health insurance plan booklet. So in there, it'll kind of go over again what that policy looks like, what it is that they require. So it's kind of like a formal document. So it's going to be really important for you to take that into consideration. Again, Medicaid state-based health insurance varies state by state. And then also one thing I also want to underscore is that due to the Affordable Care Act, you are able to stay on your parents' or caregivers' insurance until the age of 26. So if you do find yourself in that category, whoever's the policy holder will be notified when you use that when you access that insurance. But what you can do is request that all of your bills and your documentation be kept confidential and sent to you personally. But at some level, whoever is the policy holder of the plan will be notified when you use it, right? So I say this just because I don't want to create any situation or any tension that could find folks homeless or without resources. So it's really important to keep that in mind, but also that you do have certain protections. So really call your insurance and ask that, certain protections are put in place to keep your privacy. Other important insurance considerations is that some college student health plans offer really great and comprehensive gender affirming care. So if college is on your to-do list, or if it's something that you're looking for, that's also something to look at. And then also certain employers are very proud of their inclusive transgender health policies. So if you're looking for jobs, you can also look to that as well as to guide you in insurance. Another important thing to mention is that if your insurance through your employer is self-funded, and self-funded is a way for the company to kind of save some money, there can be exclusions to gender affirming care, but you can ask your HR to remove them. And if they won't, or if they say that they're not going to, there are legal options that you can pursue. But just know that, again, if the health insurance offered through your employer is self-funded, there might be some navigating that you have to do to get the gender affirming care that you deserve. Insurance denial appeals, they're always very unfortunate, but they're also a very sometimes necessary procedure that you'll have to go through. So again, in WPATH, it's stated that the age of 18 is the age of legal majority, meaning that's when insurance will cover for like top surgery or bottom surgery. But we have seen folks who are less than 18, 15, 16, 17, who have accessed top surgery or double mastectomies, but they did have to go through that appeals process, right? So after your consult with the surgeon will then send off the authorization to get approved for surgery. And if you are under the age of 18, there is a chance that it will be kicked back and said that it is denied. But again, that's just seen as a little bit of a speed bump. There is a process for you to appeal that decision. And again, it's that kind of underscores really having a robust and well-rounded care team, because then your primary care doctor, your mental health provider can go to bat for you and challenge that appeal from a medical and mental mental health professional stance, and hopefully get that overturned. Again, we have seen trans mask identified folk who are under the age of 18 get that care, but it does kind of vary again based on your insurance. For folks who cannot apply for health insurance or like Medi-Cal in the state of California because of their immigration status, there are ways for you to get that gender affirming care. So My Health LA is specifically for folks who are undocumented, so that's a really great resource for folks to know about. And then also some Planned Parenthood locations do offer sliding scale costs and do offer hormone therapy, so that's also something that you can use as well. And then again, I know it's a little bit dismal to look at the state or the map of the United States and see that most states really don't provide trans-inclusive healthcare, but I wouldn't say that you're hopeless, right? Really kind of accessing local LGBTQ+ centers or the resources that I will talk about later, or even local health systems in helping navigate that. So I don't want you to, lose hope based on the state that you live. There are resources out there for you to look at. Again, so if you ever need to approach insurance, if you need to go to a self-funded plan, these are some tools that you can use to kind of challenge that decision and hopefully get it overturned. And again, if you need the appeals, again, the well-rounded team is going to be super important. But appeal. I would encourage you to do that. It does take time. It is a lot of energy. But unfortunately, that's kind of the state of healthcare right now. So now to get into some resources. So we are not the only folks providing this care. We are not the only organization doing these kind of webinars or videos. There are other online-based resources that you can look at. Transcend Legal, the National Center for Transgender Equality, the Transgender Law Center. These are all web-based resources that look at policy state by state. Again, I mentioned the Human Rights Campaign at the beginning. They also have stuff that you can look at as well. They also have state-by-state breakdowns and specific insurance plans and what those benefits look like. So if you find yourself outside of California, you can look at these resources to get a better understanding of what it looks like or trans healthcare looks like in your state. Again, we mentioned letters being kind of a speed bump in some regard, but also a need to checks and balances for gender affirming care. And they have the Gender Affirming Letter Access Project, or GALLOP. So these are mental health providers who have pretty much said that they are open to writing the letters required. These are mental health providers who are open to writing the letters required for surgery. And it does go state by state. So I would encourage you to look at that to kind of see who's in your neighborhood, who's in your area, and how you can access those letters. Additional resources can be found on our UCLA Gender Health Program website. So if you go to our website, go to the resources tab, there's also a bunch of other resources as well you're free to look at. All right, so now I think it's time for some questions, and I think we have some. Thank you. Okay. So the first question is, what does informed consent model mean? That's a good question, and I didn't cover that in my presentation. Informed consent model means that any provider will kind of go over the cons and pros of choosing whether or not to go down a certain route or a certain intervention, so whether that be surgical or hormone therapy. And if they feel that you have the capacity to make an informed decision, they will go ahead and give you a document for you to sign, and then care can proceed. So again, it does vary by program. Some programs do require a letter from a mental health professional or primary care doctor. Others do operate from an informed consent model, which is pretty much just a general conversation, talking about your health, your care goals, and then if everything checks out and that provider feels comfortable that you're able to make that informed decision, they will go ahead and prescribe you the treatment that you're looking for. The second question is, how do I know if my health insurance plan is self-funded or insured? Another great question. Generally, you can go to your HR department and ask for that. And generally in the plan booklet that I mentioned earlier, it'll also say kind of on the front page whether or not it is or is not self-funded. But generally, if you go through your HR or your benefits coordinator at your employer, you'll be able to figure that out pretty quickly. Who can write these letters or statements of medical necessity? Again, another really great question. So these are primary care doctors, anybody that's in your care team, whether that's a mental health provider, or like I said, a primary care doctor. So pretty much anybody with like a medical or mental health background can write these letters. And again, it will vary based on your insurance plan. So to look at your plan booklet, look at the transgender health policy, and sometimes it'll specifically say one letter must be from a mental health professional, one must be from a primary care doctor. So it's going to be really important for you to look at that. But generally, it is a mental or medical professional. The last question that we have is, does health insurance cover mental or behavioral health services? So most insurances do cover mental or behavioral health services. Again, if that's something that's important for you and accessing your care, that's something that you can research again. But generally, most insurances will have mental health coverage. All right, so thank you so much for your time. I really appreciate it. If you want any more information, you're more than welcome to give us a call, contact us. This is our contact information. I know things are a little hectic right now, but I really hope that all of you are staying well. You're following CDC guidelines to keep yourself as well as yours safe. And if you are ever in need of up-to-date, fact-based information on COVID-19 or coronavirus, please feel free to go to the UCLA Health website on COVID-19. Other than that, stay well, everybody. Take care.